Camera's there.
Okay.
Hey, everybody. Z-Dog MD, Dr. Zubin Damania. I am a Stanford-trained hospital specialist, and this is my daughter, Z-Pup. And today we thought we would do something different and live because we were having dinner, and Z-Pup was like, I'm really anxious. What are you anxious about? Coronavirus. And why? Because they canceled school. So as of Monday, there's no school. And Z-Pup is in middle school. We're in the Bay Area of California. And people are freaking out. They're losing their minds. And so we can tell them the Bay Area. We just can't tell them exactly where. Otherwise, the anti-vaxxers come. So she was quite anxious. She likes school.
I like school.
And they canceled school. And so you at dinner were very nervous. And what were you nervous about? Like, ask me some questions and I'll see if I can answer them in a way that you believe me.
First off, how is it pronounced, like the real term? Is it COVID or COVID, like some people pronounce it?
That's a good question. I believe it's COVID because it stands for coronavirus something 19, which is because it was first discovered and characterized in 2019. It's a new virus in terms of human exposure. So it might have been existing in animals, but now it's jumped to humans. And so since it was first documented to do that in 2019, that's why we call it COVID-19.
And there you go, person who I will not mention, but I'm talking to you.
I suspect she has a friend who pronounces it COVID. What else are you worried?
It is not my friend.
What else are you worried about? You're in 6th grade, by the way.
Does it kill most of the people it infects?
What a good question. What do you think?
Yes.
You think it does? So if it killed everybody it infected, how would it spread?
Through dead bodies at funerals?
Right. So all joking aside, that's exactly what Ebola does. It kills a large percentage of people that it infects. And the reason it spread locally in Africa is because there was a cultural thing around dead bodies where you wash the body, you have a funeral, and so the exposure to the blood and the dead body is why people got sick. But a virus is not very successful if it kills its host most of the time, because the host doesn't have a chance necessarily to spread the disease unless it happens early in the disease. So with COVID-19, with coronavirus...
Not COVID.
Not COVID. The virus actually... For most people, the majority of people, maybe 80% or more or less, depending on what numbers you believe, and that's part of the problem. The reason you see a lot of grown-ups are scared is they don't know what the numbers actually are because they don't trust the Chinese government. We see it in Italy, but there's not a whole lot of good information coming out except for information that makes people really nervous. But let's say it's about 80% of people have a disease that doesn't require you being hospitalized and you get better. It feels like you have a bad headache and a fever and a cough and a sore throat and a runny nose and muscle aches, maybe a little bit of diarrhea at some point. And for most people, that's all it is. It's like a bad cold or flu. But for the people who get sick, and we still don't know why that is, so maybe they have a genetic, they're born in a way that makes them more susceptible to this, or maybe the virus has different strains and some are more dangerous than others, or maybe, although I don't know that's the case, or maybe because people are older, they're more risk because if they have other diseases like heart disease, lung disease, their diabetes, they're at more risk. And so it seems to affect those people more. Now, the thing is, so the reason the grown-ups are freaking out is because, of course, it still can affect someone like my age. I'm in my 40s and I'm relatively healthy, but people have, the doctor who first kind of reported on this actually was killed by this virus and he's only 33.
Ooh.
Yeah, so that's why people get worried about it. But the thing is, being worried about it is one thing. Actually keeping yourself safe is another thing. So what else is on your mind? What other questions you want to ask? We can talk about that.
Oh, I forgot what I was going to say. You talk too much.
Typical. I do talk too much. That's true.
You know how kids get these really nice smelling hand sanitizer and they smell super good. So does hand sanitizer kill the germs if you put it on, or is it? I mean, it does. Better to wash your hands, but
Oh, what do you mean? Duh, it's better to wash your hands. Most people don't know that. So let's talk about that. So hand sanitizer, the alcohol-based hand sanitizers are useful because you can rub it on your hands and wait for it to dry. So you rub it until your hands are dry. That means the alcohol's evaporated. It's actually the evaporation of the alcohol that kills the germs.
But Dad, it only kills 99 point whatever of germs.
Nothing is perfect. Hand washing is better. Mm-hmm. And the other thing that those alcohol gels don't do is they don't kill certain spores like Clostridium difficile, which is another kind of infection. With COVID, it's COVID. Now you got me saying COVID. With COVID-19, it is a helpful thing to do as part of a bigger thing. So let's talk about that. You were at school today. Your sister was at school today. There's hundreds of people in your school. Many of them might, we don't even know, but might have this infection. And because young people typically don't show as aggressive symptoms. So like if I get sick, you're going to know I'm sick. I'm going to be like, I'll have man flu, basically. I'll be like, have like a thing with the ice, like in the old movies, like sitting there going, oh, woe is me. Whereas you might just be like, that's it. And I'm better. So you may be in a school with a bunch of kids. What is it that people are recommending now? Why are we closing the schools?
So kids don't spread it from kid to kid until their parents get it, and then their the friends of the parents who are grown-ups and are more prone to the interestingness of the virus?
Exactly. That's exactly right. But let me ask you another question. Why is it that we have more colds in the winter in the in the northern hemisphere than in the summer?
Because viruses grow like something like better. Oh, I said so many likes. Kids.
Viruses, no, you're on the right track. Viruses tend to survive and reproduce better, it seems, in cold weather, the viruses that cause cold. Not exclusively, but they do. But what else is the big difference between summer and the rest of the year?
Summer.
We were just talking about it. It just got canceled.
I don't know. The sweat makes your germs melt off? I don't know.
School.
Oh.
School. So when school starts in the winter, kids are put close together. Kids are filthy little fomites, meaning they spread disease because they don't know how to wash their hands and cover their cough and not pick their nose and eat it. And as a result, schools are big festering incubators of disease. And the reason the public health authorities are recommending now that we close schools in many cases in our hotspot where there are a lot of cases, I think there were 80 cases in Santa Clara County and 40, some of them are hospitalized that have been identified. So why, okay, let me ask you a question. This is a virus that spreads really easily. That's what you were anxious about, right? Am I going to give it, you were anxious about you're going to give it to mom or dad and mom or dad are going to die, right? Mm-hmm. First of all, I ain't going out like that. COVID-19, or if that's what your real name is.
Not COVID.
No, COVID. I ain't going out like that, so don't worry about that. But what you should worry about is what you can control. And what can you control? Well, it turns out the U.S., our country, screwed this up. We had time to be warned of this. We could have started testing anyone who was suspicious and at least gotten a good sense, and we could have done aggressive mitigation and containment. We did none of that. So now what happens is we have community spread of this virus. So it's going person to person to person out in the world. Most of it we're not even detecting because we don't have enough testing because our government is idiotic. And the second thing is that because it's now out there, it turns out that this is a pretty infectious virus. So it's transmitted, we think, because when you sneeze or breathe or cough, the little droplets fly out about 6 feet away.
Gross.
And can get in your eyes or your nose and give you the disease.
Ew.
So one person can infect maybe 4 or 5 other people. It's a pretty infectious disease, more infectious than influenza. So what that means is that it's going to spread pretty quick. Now, so you can panic and freak out, which is useless. Or you can say, okay, so how can we, now that it's out in the world and the government already screwed up, what can we do to make it better? So what do you think a problem is where, let's say like 20% of people who get sick. So if there's 10 people who get sick, 2 of them end up in the hospital, let's say. And you have a ton of people getting sick, like hundreds of thousands of people. And we only have 995,000 hospital beds in this country, period. all over the country, and only like a small percentage of those are for very sick patients. That happens with this coronavirus. Our healthcare system gets overwhelmed. That's why Mom, who works at Stanford, is like, okay, we have to be particularly vigilant and careful because you want to make sure we have enough capacity to treat sick people. So what can we do now? We kind of slow down the spread of the virus. Because let's say all of us are eventually going to get sick. Just pretend, okay? We're all going to get it. If we all get it right now, like in the next month, what will happen?
Oh, that would be really bad.
Why?
Hospitals can't treat that many people, and then the people who are treating the patients also have it, so who's going to treat them?
Nailed it. If we overwhelm the hospitals and make our healthcare providers sick, and this happened in China and in Italy, it's happening now, then we're going to have to start making tough decisions, like only certain people are going to get ventilators to help them breathe, other people are going to be left to die. Because you have to allocate what little you have among a lot of people, so you have to make tough decisions. Now, if that has to happen, that has to happen, but we would rather not have that happen. So what can we do to change this? What do you think is another way? If we're all going to get affected eventually, let's just pretend that's the case. It's not true, but let's pretend that's the case. What can we do to prevent the hospitals from being overwhelmed?
Quarantine yourself and never go out of your house until you die.
You're on the right track. Not quite, but this is what they're talking about when they shut down the schools, when they talk about social distancing, which we're going to talk about, when we talk about washing our hands and covering our cough, when we talk about not traveling unless it's necessary. What that means is, you know what the term is called? It's called flattening the curve. Have you heard about this? So imagine that here's the number of cases of people getting sick with coronavirus over time. So people get sick, and then they get better or die and get better, right? So this is a steep curve. If everybody gets sick at once, we overwhelm the system, more people die. If we flatten that curve, the same number of people get sick, but over a longer period of time. So instead of an epidemic lasting 3 months, it lasts a year, say. We have better capacity to take care of people. We have more time to figure out what cures are and treatments are and best practices are and vaccines development, because that can happen. Yeah, science.
Did you just crack your finger?
I sure did, because I do that. Also squeeze my little stress toy.
It's mine.
And by flattening the curve, what it means is you're slowing the rate of infection so that you have more time to respond and don't overwhelm our system. That's the phase we're in now, the mitigation phase. We can't contain this virus, but we can mitigate how quickly it spreads. So what are we doing to do that? Or what are you, tell me, because you're still worried about this thing. What questions do you have?
Oh, you know how kids get these, you know how I mentioned that they get really nice smelling hand sanitizers?
Yes.
So when they use it, and if you smell their hands, will you get sick if they have it?
So they use the hand sanitizer, you smell their hands, will you get sick when they have it? Well, there's a couple...
That's what a lot of people do. They're like, oh, that smells so good. Can I smell? And then they shove their hand in their face. I'm like...
So that's a great question. And I'll tell you why. It gets to the heart of what we're talking about with what they call social distancing. Do you know what that is?
Yeah.
What?
When you're not...
Yeah, that's the simplest way to talk about it. But the more complete way is to say, when authorities say, okay, we want to slow the spread of this virus, social distancing means what we're doing right now is wrong. Now, we can do it because we're a family and we're going to be together anyways. So if we get infected, we're infected. Although if I get quarantined, I'm staying away from you. If you get sick, we're going to stay away from each other at a distance. Social distancing means avoiding other people to the tune of about 6 feet, because that's where the droplets can spread, right?
Ooh, I felt something.
That's a droplet, because I have loose lips.
Someone says you don't look well, and because you have those dark rings, and then they asked, I don't know who it was, it went too fast.
People love to complain about my dark circles, forgetting that I'm Persian.
I can't believe nobody has complained that he's greasy.
That's racist.
It's only me.
That's racist.
Do you feel how greasy that is? It's like so much grease.
There's no grease.
Yes, there is. I feel it.
Watch. Is there any grease there?
Yes,
no.
there
Okay.
is.
Back to social distancing.
Ew,
So speaking of which, the idea of smelling somebody's hands. So 6 feet away, means you're less likely to get droplets. Staying away from social events and mass gatherings means less people in contact with each other. Not going out unless you have to and staying at home means preventing the chance for this virus to spread from person to person. So the thing about social distancing is it becomes complicated. So you close the schools. Well, what happens? Now the nurses who have kids in school can't work. So now you've reduced the capacity of the hospital. So you have to kind of weigh all these things. But if we can slow the infections down, it's going to be a better answer. So social distancing in the Bay Area means maybe not going out to eat so much in crowded restaurants. It may mean cooking at home. It may mean avoiding like events that you can avoid. Big conferences are canceled. The NBA season is canceled. Big gatherings are canceled. So this is a way that, now part of the reason you're anxious is you've never had the schools closed before. So social distancing, let's really think about this. We're social animals. So if you say avoid other people to human beings, they go, what? And imagine you're already kind of lonely and in your house. Now you can't go out, you can't date, you can't do all these things. It's really hard. But here's the thing. Sometimes things are hard. We've had it pretty easy for a while. Sometimes things get hard. And I think we just have to come together and say, okay, it's going to be hard for a while. We're going to step up and do what we can. We can be afraid, but we will not panic, and we will prepare. And we'll use science. We'll science the crap out of this stuff. And we'll use...
under here.
There it is. Science the crap out of it. That's Risa's great piece.
Makes me slouchy.
So, that being said...
I have another question. Now,
Okay, give it.
Okay. Can animals get coronavirus?
Ooh, what a good question. So, it seems like this coronavirus came from animals. And
Bats?
Well,
civet cats?
Bats... Is it snakes? Nobody knows, right? Yet. But typically, bats have been a reservoir for coronaviruses, which is the family of virus that this is. Now, the question we care about is not about bats, because there are very few of us that keep a pet bat. We're worried about our cat, Mitch, dogs, lizards, birds, and again...
What if we just did... No offense to bats, but...
Just kill all the bats? Bats serve an important ecological
niche.
niche.
But like...
how about this? How about we stop invading bats' territories?
Yeah, it was just a thought.
We stop eating bats.
Ew,
we stop
it's just gross.
encroaching with human settlements on where bats are native, because that's where the human-animal interface happens, and that's where one person in China interacting with an animal has now affected the entire world economically, health-wise, and psychologically. One person interacting with an animal, right?
Well, they kind of suck.
Well, no, it tells you we're all connected. And if we're going to stay connected, we better connect right instead of unhappily, all right? So can animals get it? For the most part, the answer seems to be no. But again, I'm not a veterinarian, so I can't say that. Now, they do say when you're quarantined, you should stay away from people and animals. But in general, now remember also, if you're touching an animal, when you're coughing and you're sneezing on an animal, that animal goes to another human, the human touches and pets that animal, they're going to potentially catch the virus, right?
Gross.
Yeah, it is gross. That's why, what's the other thing you do? Wash your hands for the duration of two happy birthdays.
To you. Happy birthday to you.
Happy birthday, dear
Weirdo.
CDC. You screwed this one up. You know what? I got to say something real quick, little Z-Pup. I believed in the CDC. I trusted them. I thought they would do the right thing. Instead, what I see is a politicized organization that is fumbling and bumbling this thing along with other government entities. And we had lots of warning, and they got to be held accountable. That's all.
I need to ask you another question before I forget it.
Please.
Is Trump doing the right thing with coronavirus?
Why you ask that kind of hard question to me?
I don't know.
So this is.
Oh, the slogan for not electing Trump should be "Dump Trump, Dump Trump." Okay.
So we don't get political on this show because honestly, I don't really care about Trump or Biden or Sanders. What I care about is whatever's best for the country. And I'll say this. The government response to this thing has been abysmal, period. So now the question is that Trump? Well, the buck is going to stop with the president, or is it CDC, or is it whatever public health service we're talking about, or is it local government, or is it, it gets complicated. There's no, unlike what the media will tell you no matter what, there's never a black and white answer. It's always complicated. The bottom line is we need to do something. That's why your school is canceled. That's why we wash our hands for 2 happy birthdays. That's why we cough into our elbow. That's why we try to flatten this exposure curve. That's why we do not panic, and we do not believe everything we see on TV or in the media, right? And we certainly don't believe everything we see on Twitter, because if you did, this would already be a Stephen King level apocalypse, and it's not going to be that. It's going to be hard, but we will get through it. Other tough questions from the Z-Pup, Rebecca Jones points out that you asked the tough questions.
Yeah. Also, did you sneeze on that, or is that just weird gunk?
That's a wax from a candle we exploded for a video shoot.
Why?
Other questions that you may have, my Z-Pup. If you get sick, what should you do?
Kill yourself.
100%, 1,000%. That's called autophagy, self-destruction. Yeah. You need to do that. No, you don't do that. What do you actually do? What happens if you start having a fever right now? What would we do? Should we run you to the ER?
Yeah.
Okay.
Totally, yeah.
I think if you have no insurance and you have no connection with a primary care doctor or a facility, then you don't have another choice. If you do, however, a good answer would be to call your doctor or their triage nurse or whoever and say, these are my symptoms. I've been having them for this long. These are my other medical problems. This is my age. I'm wondering what I should do. And they will tell you either come in or ask some more questions or stay at home, watch for these signs, getting worse, shortness of breath, having inability to keep down liquids and stuff like that. If that happens, then you come in or call 911. And that will reserve our hospital.
You throw up?
You can throw up with any infection. And diarrhea is actually something that we've seen with this particular infection a little bit in the thing. In fact, in China, one of the super spreaders of this that showed up at a hospital had abdominal pain and was seen by the surgeons, ended up infecting a ton of people in the hospital because they had misdiagnosed what was ultimately coronavirus. Very, very interesting and unpleasant. Risa Dubois says she's super smart despite her parenting. That's what we do.
Nice one.
Other questions, Zipa? You realize there have been like 3,000 people watching us this whole time. That's an auditorium full of people.
Okay.
Mm-hmm. What I'm saying is don't choke. No pressure.
Okay.
Look, Tiffany Wietek. My 5-year-old's had fevers for 2 days now, and I refuse to take him anywhere while he's stable. So, Tiffany, as long as you're in cahoots with your pediatrician, or you are a pediatrician, that's not unreasonable. But I would definitely make sure that there's no other risk factors for your child, and everything else is stable. I can't give medical advice, but I would say that, especially with children, you're very lucky, have generally been spared by this for some reason, and there's theories about it. Could it be that you guys lack receptors for the? I just spit. Gross. That is why we keep.
Onto my donut.
That's why we keep 6 feet social distancing. You
lean back here.
The kids may have no receptors, or they may have a different immunological profile, like they've been exposed to different things, their immune system is different, and it doesn't react the same way that older people do. So there's something really remarkable that we need to learn about human physiology and immunology that this virus is trying to teach us that we haven't learned yet. Let's see where we're at here. Super cute young lady, says Shawnee. Kylie, single mom and an 11-year-old. What do I do to keep her safe if I get infected? Kelly Thorman. So you have a 11-year-old. I think what you should do is, at that point, you have to talk to your own physician. But the truth is, you try to keep distance in the house. You have a separate area. And you really have to avoid interacting if you want to keep that child from being infected. Now, the thing is, in general, statistically, the child's going to be less likely to become very ill, but it's not impossible. So if you have family that she or he can stay with, if you have, and you're a single mom,
and let you die alone,
really tough.
That's not nice.
No. And this is listen. Let's be really serious here, because Kelly, okay, you're anxious. You have 2 parents. You have a decent amount of money.
Is that high?
You've had pretty much every privilege, right?
Mm-hmm.
If one of us gets sick, the other can cover. If both of us get sick, Victoria can help. If all of us get sick, my parents can help. What happens when
you might get them sick.
But what happens when you're a single mom like Kelly and she gets sick and she's got a kid? What do we do?
Yeah.
What happens if Kelly is a nurse or a CNA or a pharmacist and she gets sick, or her kid is no longer in school because they closed school and she can't afford childcare? Well, we lose somebody right there. These are huge questions. This is why people have a level of concern about this thing, right?
Me?
Yeah, like you. But we will handle it. The idea is you talk about it, you figure this out, you plan for it. That's why I really have to say we have to hold our leadership in this country and in our organizations accountable, and we're going to learn a lot from this. The first thing is, when another pandemic happens, we're going to be better prepared. The second thing is, we're going to learn a lot of science. The third thing is, this whole idea of we don't need a bunch of unessential meetings all day long. A lot of stuff can be done remotely. There's probably better ways we can be hygienic in general for the regular flu. People who think vaccines are a bad idea are morons and are dangerous. I think that's, there it is. Vaccines save lives. It's backwards.
But whatever.
They can see it backwards because they're vaccinated. And it's gonna wake people up that science matters, that we need leaders that actually understand and respect science and follow it, and that we need to actually think scientifically and rationally instead of purely emotionally, because it's been harmful, you guys. Seriously, the panic around this thing has been more harmful than the thing itself. End stop. Economic collapse, panic, craziness everywhere, runs on supplies, lack of toilet paper and masks. Why is that? Because people are emotional. That's what it is. Wow. So, yes.
How dare you?
Please.
Okay. I'm sad. This
Why
is
are
my
you...
sob story. They stopped selling samples at Costco. Dark times.
It really is dark times, because that was our whole little thing. We would do a daddy-daughter trip to Costco, and you would just go through every sample station 3 or 4 times. Just with a different disguise each time, right? Put the hoodie on. Oh, these are really good. Where are they? Oh. Come back with the hoodie off. These are delicious. Which aisle are they in? Because you have to pretend to be interested in the poor person who's working there. They're trying to sell this product. Mm-hmm. And now there's nothing. Now we won't even go to Costco because, it's a public space and you try to avoid it if you can. But again, we go out, right? We keep our distance. We wash our hands. We Purell when we can. If they have Purell stations in all these places, which I think is smart. Yeah.
Okay. Well, I forgot my question. Okay.
It's all right.
What is it? Oh.
Yeah.
Why are people purchasing water when they can just get it from the sink?
Why are people purchasing water when they can just get it from the sink, from the tap? This is why, because people in a panic mindset purchase water because they think the water is going to shut off or the water supply is going to be in problems because the people who manage it are going to get sick. Yeah. So they stockpile water that way. It's not a great idea. You want to have emergency water supplies anyways, because we live in earthquake territory, so we have a bunch of water for that reason. But you don't want to go running on water when it is in shortage, because it drives up the price and it keeps people who really need it from getting it. So you want to plan ahead in advance. You don't want to do this when stuff's hitting the fan. You do it in advance. All right. What do you think? Did we do a thing? You have any other questions?
I have one more.
Yeah.
Why do people wear, when people wear masks and gloves, the mask gets dirty and the gloves get dirty, and if you, dab your eyes, it's not even really protecting it. You have to wear a whole face ear mask, dude.
This is my child. You're a smart child. Wearing a mask in public is dumb. It's just dumb. Unless you are sick yourself and you're trying to protect others, in which case you shouldn't be out in public, unless you have to be. And so wearing a mask, or your immune system is weak and a physician has told you wear a mask, because sometimes airborne things you want, you had chemotherapy or you have another problem. Definitely. But for anybody else, you're just being a ding dong, really. And you're wasting resources and you look like a tool and you should be put on an island and left to rot. All right. What do you think? Did we do something here?
Yeah.
All right. Let's squeeze the hell out of this thing.
Oh, don't spit on it.
Who's anxious? Not me. This was fun. Did you have fun? I had fun. I wonder if the audience had fun. Let's read a couple quick comments and we'll wrap up.
We got.
Thank you for this. It's the most peace I've felt in weeks listening to you guys, Sam Nelson. That was why I wanted to do this, because you were anxious, and I'm not anxious, but I am constantly thinking about how we should be preparing and how we should be communicating this stuff, and that helps my anxiety. Preparation helps anxiety. It really does. So be prepared, not scared. All right, guys?
Oh, and the sniffling and this cough is just from allergies. I don't have COVID. Not COVID-19.
I'm going to die soon. Guys, I love you. Please do me a favor. Share this video. If you're not a supporter of this show, I still love you, but I love you more when you're a supporter, because it means you're a super fan and you help pay for all this garbage and do what we do, keep us commercial free and all that. And you are the best. Thanks to all the supporters, to everybody who donated stars. We raised 6,140 stars. We get a penny per star. That's $61. You know what that's going to go
And
to?
I don't even get any of it.
You get socially distanced for $61. I'm going to buy $61 worth of distance coupons.
And face masks.
And face mask. Yeah, that's the last thing.
There's they cost like $200.
Yeah, now they're all jacked up. Yeah, good thing Daddy bought a couple for his coronavirus music video.
Can I have one?
Nope,
So I can look
they're
like
all
an
for Daddy.
idiot?
Yeah, you will look like an idiot. I'd rather Daddy look like an idiot. All right, guys, I love you. Thanks to everyone who sent the stars and who supports the show and everyone who shares this. And we out. Stay safe out there and prepared. Peace.